Now we gotta know about eczema. What is eczema?
Eczema, or also known as atopic dermatitis, is a condition that makes your skin red and itchy. It also not contagious.
What are the types of eczema?
There are 7 types of eczema, which is atopic dermatitis, contact dermatitis, dyshydrotic eczema, hand eczema, neurodermatitis, normal eczema, stasis dermatitis. What causes eczema?
There are 2 causes of eczema, which is genes and triggers. There are 3 things that can trigger eczema: dry skin, irritants, and stress.
What are the symptoms of eczema?
The symptoms for eczema is dry skin, itching, which may be severe especially at night, red to brownish gray patch, especially on the hands, feet, ankles, wrist, neck, upper chest, eyelids, inside the band of the elbows and knees, and in infants, the face and the scalp. Small, raised bumps which may leak fluid and cross over when scratched. Thickened, cracked, scaly skin. Raw, sensitive, swollen skin from scratching.
How eczema can be diagnosed?
No test can spot eczema. The doctor will probably diagnose it by looking at your skin and by asking a few questions. How to prevent eczema?
Eczema can be prevented by moisturizing your skin at least twice a day. Try to identify and avoid triggers that worsen the condition. Take shorter baths or showers. Take a bleach bath. Use only gentle soaps, and try to dry yourself carefully.
What are the treatments for eczema?
There are some treatments for eczema, which is antihistamine, corticosteroid creams or ointment, calcineurin inhibitors, antibiotics, light therapy, and cold compresses. Now we're gonna compare and contrast between 2 products, which is whole zinc cream and Egoderm ointment. For whole zinc cream, it needs to be applied 2 or 3 times a day. Meanwhile, for Egoderm ointment, it needs to be applied 3 times daily or when required.
The active ingredients for whole zinc cream is zinc oxide, while in Egoderm ointment, the active ingredients is istamol with the zinc oxide.
The form for whole zinc cream is cream. Meanwhile, for Egoderm ointment, the form is ointment.
Whole zinc cream is manufactured by Whole Pharma, and Egoderm ointment is manufactured by Ego. The use of whole zinc cream. Whole zinc cream is a mild astringent for the skin. It is a soothing and a protective application in eczema. Whole zinc cream also a protective to slight excoriation. This is the patient information for whole zinc cream. The application for whole zinc cream is we need to stir before use. Apply 2 or 3 times daily. Before applying the cream, we must wash and dry the affected area thoroughly. The precaution for whole zinc cream. Whole zinc cream is used for external use only. Need to discontinue use if irritation or sensitivity develops. The storage for whole zinc cream. Need to keep container well closed, protect from strong light, and store below 30 degrees Celsius.
The use of Egoderm ointment. Egoderm ointment is used to relieve itchiness, red skin, and skin inflammation. It also been used to reduce the excessive hardening and thickening of the skin seen in chronic eczema. Also acts as anti-inflammatory, soothing, and mildly antipyretic. Here is patient information for Egoderm ointment. The Egoderm ointment need to be applied to the affected area 3 times daily or when needed. The precaution for Egoderm ointment is avoid contact with eyes, should not be used by individuals with non-sensitivity to ethanol. Also need to be stored in place below 30 degrees Celsius and keep out of reach of children.
The second skin condition is acne. Acne is a common skin condition that occurs when hair follicles become plugged with oil and dead skin cells. The symptoms of acne includes blackheads, whiteheads, papules, pustules, nodules, and cystic lesions. Acne can be prevented by washing your face daily with warm water and mild facial cleanser, using moisturizer, trying to use non-comedogenic makeup and remove it at the end of the day, and lastly, avoid touching your face frequently. Acne can be caused and can be triggered by hormonal changes, certain medications, diet, stress, picking at acne sores, clothing and headgears, air pollution, and certain weather conditions, using oily or greasy personal care products, or working in an area where you routinely come in contact with grease. And lastly, genetics. When you have acne, the treatment options include topical medications, oral medications, light therapy, chemical peel, drainage and extraction, and steroid injection.
Compare and contrast between two products that can be used to treat acne, which is Epidogel and Oxy Cover Cream. First, Epidogel need to be applied thinly to the entire affected area once daily at night on a clean and dry skin. Meanwhile, Oxy Cover Cream need to be dabbed on affected area and applied once a day initially, then twice daily or as directed by a physician. The ingredient contained in Epidogel is adapalene 0.1% and benzoyl peroxide 2.5%. Meanwhile, Oxy Cover Cream contains benzoyl peroxide 10%, methylparaben 0.15%, and propylparaben 0.1%. Epidogel is available in gel form, while Oxy Cover Cream is available in cream form. Epidogel is manufactured by Galderma UK Limited, and Oxy Cover Cream is manufactured by the Mentholatum Company.
The product that can be used in treating acne is Epidogel adapalene 0.1% and benzoyl peroxide 2.5%. Epidogel acts by decreasing the severity of acne and promote quick healing, while adapalene in the Epidogel can help in affecting growth of cells, decreasing swelling and inflammation. For benzoyl peroxide, it can help to reduce the amount of acne-causing bacteria, causing the skin to dry and peel off. For the application of this product, patient needs to apply thinly to the entire affected area once daily at night on clean and dry skin. There are several precaution steps, which are avoid contact with eyes, mouth, nostrils, and mucous membrane. Avoid excessive exposure to sunlight or UV radiation. This product can cause lactation and keep out of reach of children. Note that this product is a controlled medicine as it contains adapalene. For the storage, do not store above 25 degrees Celsius.
A product that can be used to treat acne called Oxy Cover Cream. The use of product, it can kill acne bacteria and cure stubborn acne effectively. Second, it also helps to cover acne perfectly with solid color similar to skin tone. Furthermore, it helpful in drying up excessive oil and helps to unclog pores. Patient information on the product called Oxy Cover Cream. First, it needs to be applied by dab on affected area and apply once a day initially, then twice daily or as directed by a physician. There are several precautions on this product. First, avoid contact with eyes, eyelid, mouth, and broken skin, and avoid deliberate exposure to sunlight or UV radiation. Second, it needs to be stored at cool and a dry place.
So, we proceed to the next skin disease, which is insect bites. The definition: insect bites are puncture wounds or lacerations that made by insects. An insect may bite in self-defense or when looking to feed. Insects typically inject formic acid. There are a lot of types of insect bites, such as mosquitoes, midges, and gnats, tick bite, bedbugs, fleas, horseflies, spider bite, and sandflies.
The signs and symptoms for insect bites are swelling, redness or rash, pain in the affected area or in the muscles, itching, heat on and around the site of the bite or sting, numbness or tingling in the affected area.
As for the diagnosis, insect bites are normally easy to diagnose, but a person will only contact the doctor in case that involve a severe reactions. For the treatments of insect bites, there are first aid treatment, painkiller, antihistamine, antibiotic, crotamidone or hydrocortisone lotion, cream or ointments, and cold compress.
Compare and contrast. The medication that we choose for insect bites are A bite and SOOV bite.
The application for A bite is we apply on affected area,
while for SOOV bite, we dab onto affected skin.
The active ingredients for A bite is crotamidone,
while for SOOV bites are cetrimide, lignocaine, hydrochloride.
The form for A bite is cream,
and the form for SOOV bite is a gel.
A bite was manufactured by Ho Pharma,
while SOOV bites manufactured by Ego.
So here is A bite cream. A bite cream comes in 15 gram per packaging. A bite cream help in relief of itch due to mosquito, insect bites and stings. The relief can be up for 6 to 10 hours. The active ingredients, which is crotamidone, helps in relieving the itching, prevents damage to the skin caused by scratching. Also, crotamidone can help in minimizing the risk of secondary infection. The other ingredients that used to make A bite cream, such as spent grain wax, Butyrosphaermum parkii, which is shea butter extract, and Argania spinosa kernel oil. First of all, for A bite cream, how do patients need to apply the A bite cream? So, the application for A bite cream for adults and children that are above 3 years old, they need to apply the cream to the affected area for 2 to 3 times a day. However, for children who are below 3 years old, they need to apply the cream 1 time a day to the affected area. What are the precautions that the patient need to take? Firstly, avoid application to eye, mouth, acute inflamed skin, or raw weeping surface. Also, pregnancy and lactation. How do patients need to store the A bite cream? A bite cream need to be stored at the room temperature, away from heat and direct light. Also, do not freeze the A bite cream unless it is required at the label.
The SOOV bite medications also help patients relieve from the pain and itch of insect bites and stinging plants such as needles. The skin is anesthetized, relieving the need to stretch. This gentle formulation contains antiseptic to help prevent infections. SOOV bite also suitable for children above 2 years and adults. The ingredients for SOOV bites is lidocaine or lignocaine hydrochloride monohydrate 3% weight over weight, cetrimide 0.5% weight over weight, alcohol, and preservative phenol-C isopropanol 1% weight over weight. It is packaged as topical 1 gel 25 gram. SOOV bite. The application. The patients need to dab onto the affected skin area 4 times daily. As for the precautions, the patients need to know that these medications used for external use only. Avoid contact with the eyes. Do not swallow. Do not apply on large areas of the body except on the advice of a healthcare practitioner. Do not use on dermatitis, eczema, anal, or genital itching. If itching persists or if the skin irritation occurs, discontinue use the medications immediately and seek for medical advice. Do not use on the children below 2 years. As for the storage, the patient needs to store the medications below 30 degrees Celsius.
Okay, so the final skin disorder that we have is psoriasis, a skin condition characterized by rosy skin coated with silvery scales, forms reddish spots and may itch, and by scratching them, it may cause the skin to bleed. The condition is caused by skin cells that grow and multiply faster than the normal rate. What are the symptoms of psoriasis? The symptoms are red, raised, inflamed patches of skin, whitish silver scales, dry skin that may crack and bleed if you scratch them, itching and burning sensations around patches, and lastly, painful swollen joints. Psoriasis triggers are stress, alcohol, injury, medications, and infections. Okay, so the treatment options available for psoriasis are like therapy, systemic medications, and topical treatments. But now we will be going deeper into topical treatments, and those are whole Serra scalp ointment and LP hydrocortisone cream 1% with overweight.
Compare and contrast. For application, whole Serra scalp ointment is applied on scalp. Meanwhile, for NP hydrocortisone cream 1% weight overweight, it applied only on the skin. For ingredients that used in whole Serra scalp ointment is coltasol 12% weight overweight, salicylic acid 2% weight overweight, sulfur 4% weight overweight. Meanwhile, for NP hydrocortisone cream 1% weight overweight is purified water, cetyl alcohol, glycerin, stearyl alcohol, propylene glycol, sodium laurate sulfate, acetyl palmitate, and sorbic acid. Form for whole Serra scalp ointment is ointment. Meanwhile, for NP hydrocortisone cream 1% weight overweight is cream. Whole Serra scalp ointment is manufactured by Whole Pharma. Meanwhile, for NP hydrocortisone cream 1% weight overweight is by Nori Pharma.
Okay, so the first product to treat psoriasis is whole Serra scalp ointment. It is helpful for reducing mild to moderate scalp psoriasis, to reduce inflammation and scales, and to slow the growth of skin cells.
For the patient information for whole Serra scalp ointment, the application is to be applied on our scalp only. And apply a thinner layer only for 3 to 7 days. And please wash your scalp after 1 hour and not immediately after you have put on the ointment. And please do be remember to wash your hand before and after applying. For precaution, avoid contact with eyes and discontinue use and consult a doctor if excessive burning occurs. And do not take by mouth. And do not apply bandage on applied area. And if you are pregnant, please consult doctor first. And for the storage, store ointment at a room temperature, away from heat and direct light. Do not freeze the ointment unless it is required to do so, and keep ointment away from children and pets.
The use of product for NP hydrocortisone cream 1% weight overweight is used to treat skin psoriasis. Hydrocortisone also reduces the swelling, itching, and redness of the skin. Patient information.
For applying, first clean and dry the affected area. Then apply a small amount of medication to the affected area and gently rub in, usually up to 4 times a day or as directed by doctor or the product package. Wash your hands after applying the medication. For precaution, do not bandage, cover or wrap the area unless directed to do so by a doctor, and avoid getting this medication in the eyes, nose or mouth. For storage, keep this medication in the container it came in, tightly closed and out of reach of children. Store it at room temperature and away from excess heat and moisture. Do not freeze it.